Welcome to the Health and Wellness Show. This is Paul Hamilton. Today we're going to be talking about TMJ disorders and different types of headaches. We're going to look at some of the potential causes as well as treatment approaches. We're going to do this from the perspective of a chiropractic doctor. Today we have Dr. Brian Dower with us. Welcome to the show, Dr. Dower.
Thanks very much.
It's a pleasure to have you here today. I was reading through your biography and it seems very interesting. I was wondering, before we really begin on the core topic, if you could tell us a bit about your area of expertise.
So yeah, I'm what I call myself as a wellness-based chiropractor. And when I say wellness-based, that kind of takes the focus off the pain and puts it onto the potential that we get patients to realize after they get through the pain. An analogy I often use with my patients, if you picture a glass that's half full of water, the half full glass of water is how most of us kind of picture ourselves as being healthy. And healthy is often defined, I guess, in our world as being having no symptoms, no diseases. And so that half glass of water, if it gets a little bit of water splashed out of it and it gets down to about a quarter cup, that's when symptoms show up. And a lot of patients come in when they have those symptoms. My goal as a chiropractor, wellness-based chiropractor, is to get them out of the pain-based or the pain area, get them back to that half cup of water where basically they had no symptoms before, but then even optimize them beyond where they started. Because again, a lot of patients come in and they may not have symptoms, but they certainly don't have health. And they may not have great sleep, they may not have incredible energy in the day, they may not have the best diet, but they wouldn't consider themselves sick. So as a wellness-based chiropractor, certainly we get them out of pain, we get them back to where they started, but we want to get them above that and get better energy, better communication between their brain and their body.
That's a great example of a half cup. I've never heard that before. That's a great way of looking at it.
Yeah.
I was wondering if you could tell us a little bit about how you get started in your field.
Well, I came at it from a non-traditional angle. A lot of chiropractors are kinesiology students, but my background was actually in marketing. I did an undergraduate degree in marketing in Newfoundland at Memorial University, and had been backpacking in Europe when I got caught between two doors on a train and wrecked my back. Came back to Newfoundland and had difficulty sitting for more than 5 minutes in a chair. Tried working with my medical doctor for 3 or 4 months, and nothing seemed to be really, taking effect. And I just said, well, should I try one of these chiropractor guys? Not having any experience in the past myself, but I was a bit desperate. And so I found a chiropractor locally in St. John's. And during the first session, I immediately had relief and thought it was astounding how quickly it worked and how simple it was. And also liked that, there was no medications involved or no surgeries involved. My younger brother was studying biology at university without any real, plan after that, and I suggested he come with me to my next appointment to see if he might want to consider chiropractic as a career, and he did, and he loved it, and after a couple of years, he applied to the chiropractic college, got in here in Toronto, and would call me year after year telling me that I should quit my job in advertising because he knew I wasn't happy in that, and make the move back to school and become a chiropractor. So after about 6 years in advertising, when I was pretty much near the point of burnout, I realized I needed to make a change, and I loved working with people. I just didn't enjoy that side of the business side of it, so made the move back to Toronto. They have what's called an alternative background clause, that allowed people with alternative backgrounds but who had worked and had some real-life experience to enter the college without the prerequisite science degrees. Once you got in, they basically made up for that. But so I moved to Toronto in 1998. 4 more years of college or chiropractic college after that, and then started practicing in the summer of 2002.
So then, with being a chiropractor now, once you went through for that training, there's a fair bit of education and training required, probably more than most people are aware of. Can you tell us a little bit about what type of education then you've taken?
Yeah, most chiropractors have an undergraduate degree for sure. The competition is quite stiff. In Canada, there's 2 schools. There's one in Toronto with the larger school. There's a small French-speaking school in Quebec. There's about 17 schools in the States, but only 1 in Canada. So the competition is pretty stiff. So they require you to have 3 years of university, but because the competition is so great, generally everyone has at least an undergraduate degree, and often they have more than that. The program itself is 4 years, and after the first 2 years, you go straight through mornings or the summers as well. And the last year is heavily focused on your clinical year, where you do a residency. when you're actually working with real-life patients under the guidance of one of the clinicians. I did mine at an inner-city clinic here in Toronto out of the Sherbourne Health Centre, dealing with an HIV and a low-income population, and that was incredibly great learning experience, yes.
So then, right now in your practice, what type of services do you provide?
So there's lots of things that you can see when you walk into a chiropractor's office. There's lots of things that we offer, and there's no two chiropractors are alike. My practice is primarily focused on the chiropractic adjustment, and people often, ask what an adjustment is. And an adjustment basically is a real gentle aligning of the spine to take pressure off the nerves. The way I think about it, and as a wellness-based chiropractor, everyone understands they have a brain in their body, and everyone understands that they have organs, and they have skin, and they have muscles. What communicates between the brain and the body is the nervous system, and the nervous system is actually accessed through the spinal cord. So another analogy, similar to the water glass, would be if you think about your spinal cord as being a huge power bar in your body, and then you have all these extension cords that plug into the power bar. The extension cords go to your muscles, they go to your spleen, they go to your thymus, they go to your the skin in your little toe. If there's an irritation where that plug is plugged into the spinal cord, into the power bar, the proper amount of energy is not flowing between the spine and the end organ. And so as an adjustment, what we do there basically is make sure there's no irritation to those cords being plugged into the the power bar. So the best thing I can do for a patient is adjust them, and that's what I do with almost 99% of my patients. We do adjustments. There's different types of adjustments. I usually focus on, it's called diversified, so I use my hands to do the adjustments. Very gentle, very safe, and it allows me really to get a good sense of what's happening under my fingers when I touch the spine and touch the body. I use some other techniques as well, an activator technique, which is a low-force technique for people maybe whose bones are a little bit osteoporotic, or for some of our children in the clinic. There's also a drop table we use. It's called the Thompson technique that I'm certified in as well. Yeah, there's different things. So I treat each patient as a new entity, and there's different options for each patient. But again, the primary thing we do is adjustments. I also use cold laser technique. There's a lot more research being done in cold laser recently. It's an incredible, safe way to help tissues heal faster than they normally are healing. We often get caught in a chronic state of inflammation, and inflammation is good. Inflammation is needed when there's been an injury, but sometimes an inflammation state stays around too long and we get caught in chronic inflammation. Cold laser stimulates the mitochondria of the cells to produce more of a chemical that's used to kind of get rid of the inflammation after it's been there for a while. So we use that on arthritic joints. We use it on tissues that have been torn, ligaments, muscles, fracture sites. Again, it's easy to use on all those. And then I also studied medical acupuncture at McMaster Med School, and so I do medical acupuncture as well, which is a really nice adjunct to chiropractic care.
So imagine you see many different types of conditions and symptoms. What are some of the most common symptoms of your patients?
Well, I guess because of the public perception of chiropractic, we've certainly seen an awful lot of low back pain patients, neck pain patients, a lot of headaches, a lot of neck and shoulder complaints. But then we start seeing things down into the arms and legs. We see people who have sciatica. We see people who have carpal tunnel or tennis elbow. So those are things that people walk in the door with, because again, they know that chiropractic works really well with that. If they've talked to their workplace safety, they'll often say, okay, you have an injury, it's good to, chiropractic works really well for that. Interestingly, what I'm seeing more and more of, talking about workplace safety, is I think in the past, a lot of the injuries that people saw in workplaces related back to, getting their arm caught in a piece of machinery or heavy lifting. But I think now what I'm seeing more and more in the clinic are injuries and dysfunction that's related to lack of activity versus too much activity. Because most of our patients, I'm located at Yonge and Bloor in downtown Toronto, so most of my patients are what we call desk jockeys. They sit all day at a desk and they're not moving, and that has inherent risks in it as well. The body is meant to move. The human genome is around 40,000 years old, so for 39,950 years, we moved. We moved all day. We moved in the fields. We moved farming. We moved even just looking after our lawns. Now we live in condos. And so what's happening is our brain is saying, hang on, this person is not moving. We're sitting for 8, 10, 12 hours. It's staring at a computer box all day, and the body wants you to move, and we're not moving. So we're seeing a lot of injuries related to the lack of motion and the lack of this physical activity in the bodies.
So out of all these conditions and symptoms that you talked about, I want to zero in a little bit on headaches. What are some of the different types of headaches a person might experience?
There's lots of headaches, and that's one of the fun parts of the job. When patients first come in, we spend about an hour going through their history with them to see exactly what's going on. Some of the big headaches that we see commonly here are tension headaches. The term that we use in our profession is cervicogenic headaches, but basically they're tension headaches. And that feels like an achy, kind of tight band around the head. Usually it comes from really tight neck muscles. So again, going back to that analogy, we're talking about people sitting all day at desks with their arms raised a few degrees to grab that mouse. Those muscles get really, really tight. You're not getting proper blood flow into the muscle to flush out the toxins. Muscles get tight. Those muscles attach to the base of the head, and if they're pulling on that base of the head, you'll get a headache with that. There are lots of other kinds. There's cluster headaches. Now, they're a lot more rare, thankfully, mostly for men. You'll get a cluster of headaches, severe burning one-sided pain. Usually it affects an eye. The eye will probably start to water. You'll have 3 or 4 of these a day for several days up to several months. Brutal headaches, and again, luckily we don't see a lot of those. Sinus headaches are really common, especially this time of the year. People get inflamed sinus cavities, and they'll get that deep pain behind the eyes, behind their cheekbones, around the nose, certainly made worse when they bend forward. We see a lot of TMJ headaches here as well. I think it goes back to the amount of stress people are experiencing in their lives, and one of the stress responses is the clenching of the jaw. And patients who wake in the morning often with headaches are good candidates for TMJ pain. So putting a lot of pressure on parts of the skull by clenching all night long, and it shows up as a headache, usually on the side that they're clenching more well, but it certainly can be on both sides. We see migraines. Migraines respond really well to chiropractic care. Often more one-sided, a throbbing, pulsing pain, often comes with vomiting or nausea or kind of a disturbance in your visual fields. Perhaps you see little lights flashing off and on. And so they respond really well to chiropractic. Then there's some of the ones that are hormonal, menstrual or pregnancy-related. You can get headaches related to barometric pressure changes. The big storm front moves in, and it changes the air pressure, and if there's already inflammation or irritation within the skull, that will increase the pressure, and patients will come in on certain days of the year when we have big changes in the pressure. We'll just see a line of headache patients at the door, all looking to get their adjustment.
So in talking a little bit about the spine that you were talking about earlier, how might the misalignment of the spine play a role in migraines or headaches?
So if we jump back to the power bar story, the nerves that come out of the top of the spine in the upper part of your neck, we call that the cervical spine. The first number of nerves come out, the first, second, third, fourth nerves. They wrap back around and they go back towards the scalp. So you can imagine, again, if there's a misalignment in the spine, that will cause some inflammation. Like if you can imagine if you had a knuckle that was misaligned, if your finger was misaligned, there'd be some swelling around that joint. The same thing happens in the neck. If there's some misalignment around a joint, you'll get some swelling. That swelling puts pressure against the nerves that are next door to that joint, and then the nerves, again, are going to be, if they're going towards the scalp, they'll be irritated. You'll also, again, if a joint is misaligned in the spine, any muscles that attach to that joint will also be getting a bit of a pull or some tension put on those muscles. And again, if the muscles then wrap up to the scalp, they'll also be pulling, and any small changes, minor changes in small chemistry issues, small tension issues can certainly cause headaches to show up in the scalp and anywhere in the head for that matter. There's a certain nerve called the greater occipital nerve, and it comes out of the second spinal joint. And again, if that's irritated, you can be guaranteed there's going to be a headache coming along with it and pain shooting towards the eye.
So then how might headaches be connected to symptoms that are related?
So good question, because again, headaches themselves are, it's a symptom. It's often not the diagnosis. If you diagnose them with a headache, it doesn't really help, because again, is that headache because of they're dehydrated? Is because there's a misalignment in the spine? Is because they're having a rebound headache because they just gave up caffeine? What we look at with headaches, we look at things like, okay, let's check out the jaw. Let's see, are there jaw issues as well? And patients are often surprised when they come in complaining of a headache, and then I get in and I check their jaw, and I check the muscles inside and outside their mouth, and they have trigger points there. and palpating those trigger points causes the headaches to come back. Some patients come in and they have really, really tense shoulders, or they'll complain of shoulder problems. And again, the shoulder problems often can link back to a headache. Certainly, again, we talk about things like constipation and dehydration. They can certainly cause headaches because they're changing the body chemistry, and they change the tension within the arteries that supply the blood supply to the head. And if there's tension there, patients can get headaches with that as well. And again, certainly, neck pain is often accompanied by headaches as well.
What about stress? I imagine stress might play a role in some of the symptoms that we've discussed.
Absolutely huge. And when patients come in on their initial visit, we spend a lot of time teasing out the stressors in their life. And they often think that I'm just being nosy, I guess, but in fact, I really want to find out what the stressors are in their life. There's physical stressors in their life, and people understand those easily. Physical stressors like lifting heavy boxes or sitting all day, maybe in a factory, hammering into a wall. There's also emotional stressors and chemical stressors. And your body doesn't really care if you're emotionally stressed, chemically stressed, or physically stressed. If you're stressed in any of those three ways, your body will start what's called the stress response, and maybe some of your listeners have heard of the fight or flight response, which means that when you're under any kind of stress, again, physical, chemical, or emotional, your body instantly starts some chemical processes that cause changes physiologically in your body. One of the first things it does, it tenses up muscles. You know yourself, Paul, if you were walking home one night and somebody jumped out an alley, with a baseball bat at you, you're going to tense up pretty quickly. Your muscles will tense. Your heart rate will increase. You'll pump out more blood. You'll send more blood both to your brain and to your legs because they're your running away muscles. Your pupils will constrict. You'll start to sweat. These things all happen really quickly. At the same time, you'll stop sending blood supply to your stomach. Your digestion will slow down. Immune function slows down. So when you're under stress, especially chronic, long-term stress, like that example I gave you of being chased down the street is a rare analogy. A lot of people sit in desk jobs all day or in relationships or where they're basically low-level stress all day long. Even though it's not being chased down the street, there is that low level of stress. Your body reacts, your adrenal glands release cortisol, norepinephrine, adrenaline. These hormones in your bloodstream, even at low levels, can cause tension in the body and tightness in the blood supply that supplies the vasoconstriction that causes blood supply being decreased to your brain, and that can certainly lead to headaches as well. So I'm really, really interested in stress, and we deal with a lot of counseling on patients with stress. If it's emotional stressors, we certainly have lots of resources to send patients out. If it's physical stress, we try to diminish them. If it's lack of activity, we make sure we get them active again, get them back to the gym. And we do a lot of work on dietary needs and issues as well. Because again, if supper for somebody is, a bottle of Coke and a bag of Doritos, and that's what they're having for supper 5 days a week, that's going to chemically stress the body, and the body once again will just trip over into that fight or flight response.
I'm starting to get an idea of just how complicated this may be and what a role that you would play in trying to uncover what the causes are. So once you've had your assessments with your patients, could you describe a little bit about your treatment approach for the symptoms that we just talked about?
Right. So once we identify them, it's a conversation that we have on the second visit where we kind of go through and I kind of tell them back what they told me. And often in the telling of that story back to them, they kind of get it. They go, yeah, probably drinking 6 coffee a day may be too much, and explain to them why. So it's a lot of education as to why certain things they may have heard about in the past is not good for them. So they may understand, or they may have heard that having too much of, let's say, wheat in their diet or dairy in their diet is bad. They don't understand why. So we take the opportunity to educate them so they can make decisions for themselves. Then what we do, I'm a big believer, I always tell the patient, it's your time, it's your money, and it's your body. It's my job to recommend what I think you need, and it's your job to say, yes, I do or don't want to start that process today. If they do want to start it, great. We'll start adjusting them, decreasing the pressure and the stress in their nervous system. If they're not ready yet, I'll give them some options and say, you know what, when you're ready, compact your files open. If the patient is not really committed to making those changes yet, if they were forced to come here and they didn't really want to start dealing with these stressors in their life, it's not a great time to start. I like them to kind of come here when they're ready to make those changes themselves. Usually we'll see patients for a number of times a week up front, because again, you have to change the patterns that are existing, and these patterns have been existing often for years and decades. So as you can imagine, if I was to ask you, Paul, are you right or left-handed?
Right-handed.
If I asked you to write your name with your left hand, you might scratch down something that might look like Paul, but chances are we couldn't read it. But if I said, okay, I want you to do that every day for the next month, you probably would change that pattern eventually. The same thing with adjustments. One adjustment doesn't change your life. It's like eating a salad or going to the gym once. It's a great start, but it doesn't change the world. So we adjust patients a number of times up front to get things moving in the right direction, and then we pull back on that generally because they don't require the same frequency of care once their body starts moving in the right direction. We often, lots of times we're using other therapists in our neighborhood as well in our building. Maybe it's a naturopath to work on dietary issues or blood pressure issues. Massage therapy is an incredible technique that I strongly believe in, again, because there's so much tension in the body that if that body is, as stiff as a 2x4, it's difficult to get changes to happen. So we get them to get up there on the massage table, relax some of those muscles, and then also just take that hour for themselves when they're not responsible for their kids or their coworkers or their spouse, when they can actually just look after themselves, and that's very beneficial as well.
So back to what you started talking about at the beginning, where you're talking about the glass being half full and then being in pain, you're going down to a quarter of a cup half full, and then trying to get them back to wellness. So I imagine people come in very often for pain-related issues, but really what people ultimately want and what you want as a goal in working with them is overall wellness. So how can your treatment also lead to overall wellness for your patients?
So we tell patients again, a lot of it is explaining to them how things work and explaining to them again that the absence of symptoms does not always equal health. And so I ask them on what are your 5 goals for your health? People often have goals for finances. They have, a 5-year financial plan. They'll have career plans. They'll have family plans. A lot of patients haven't thought about what their goals are for their health, and I like to challenge them on that. Say, okay, in 5 years' time, what do you want to be doing? Do you want to be running marathons? If you're an elderly person, do you still want to be able to look after your own home? And then kind of challenge them, well, what are you doing today that you think will help meet that goal? And a lot of patients are surprised that they're doing nothing. The goal may be, for some people, we have one patient who the problem was a lot of mobility issues and wasn't able to walk to her neighborhood mailbox to get her mail. So her goal was to be able to walk to her own mailbox. And for her, that was a really realistic and a challenging goal, but one that she wanted to meet. For somebody else, we have patients who do these ultra marathons where they run through the desert for 5 days, a marathon a day for 5 days. It depends on where you are, what you're starting with. So I always acknowledge where they're starting and where they want to get. And then I challenge them again that we'll ask questions. Well, do you really think that cigarette smoking is helping you work towards that goal? Do you really think that not doing any kind of exercise at all will help you meet that goal of being able to walk a 5K race? And then basically put plans in place for them to meet small steps along the way to meet those goals of wellness at the end of the day. A lot of it, again, is just going back to explaining to them again the fact that you kind of got to have a plan in place, you have a goal to work towards, and then do small steps every single day towards that. There's 1,000 opportunities a day to make decisions. Do I eat that brownie? Do I not eat that brownie? Do I take the elevator? Do I take the stairs? Do I get off the subway one stop earlier and walk an extra 2 blocks? Every time an opportunity comes up like that, I want them to think about it and think, okay, how will this help my 5-year plan for my health? And then it's easy then to make big decisions when you think about it in that light.
That's some terrific insight, Dr. Dower. Now, if somebody wanted to know more about headaches, what are some of the most important tips you could have for them from your perspective?
Headaches themselves are a symptom, and it's really important to know that. It's not a diagnosis. So I want them to think about it as a symptom of something else, and then challenge them to play detective with themselves. What has changed? So I always ask patients, what's changed in the last, if you came in today, Paul, with a headache, and the headache's been there since you woke this morning, I would say, okay, what's changed in the last 48 hours? And you may say nothing. And so let's tease that out a bit. Have you changed anything in your diet? Have you changed your pillow? Did you fight with your spouse last night? Was there something that you're used to doing that you haven't done lately? Did you get enough water yesterday? What are you doing that's changing the environment? And then they start to understand, okay, well, so the headache itself, something else in my body that's going on. Okay, so I went to the gym yesterday and I really overdid it and I strained my neck. Okay, so let me think about this. My neck is irritated. Let's check that out and see that that's causing a headache. that may be the connection. I'll ask them about posture and say, okay, well, look at your posture. Let's look at that. Is your posture a strain on your neck, and is that affecting what's going on in your head? Are you drinking too much? Did you have too many drinks last night? Sometimes it's easy as that to kind of identify that it's a chemical stressor in the body. It's always about what's changed, because the body in itself is never wired for pain. Every strand of DNA in our bodies is made to be healthy. If we're getting too much or too little of something, if we're toxic in something, meaning getting too much, or deficient in something, there'll be an imbalance, and that can lead to headaches and symptoms. So it's always about looking at where are we toxic and where are we deficient. And then patients, more times than not, come up with a solution. They say, oh yeah, you know what, now I realize what it was. Yesterday I had 4 Diet Cokes in the afternoon, and that's probably instead of drinking my water, so maybe that's the imbalance causing this headache. Or they realize, yeah, I fell asleep on the couch last night with my neck at a crazy angle. There's a bit of stretch there in my neck, so that's probably related to it. So I want them always to think about the headache as being not the answer. The headache is part of the puzzle. They need to figure out more of it than that.
Those are some really terrific tips. Now, if somebody was looking to visit a chiropractor, though, what should they know or look for?
Well, like in every profession, everyone out there, my big thing is personality and skill. Those are the 2 things you want to get an assessment on. Skill is something that you kind of want to go online, get a sense if they have a website, or talk to current patients that go there. Ask them what are their training, what's their background, what techniques do they use. I've tried advertising. I've done lots of different things in the past when I first started practice, and what generally builds practices are referrals from existing patients. So ask your friends, ask your neighbors, ask your siblings, who do you know is out there as a chiropractor, and find out what they do. Because again, there's lots of people out there, but you want to find out if they're skilled. Most chiropractors will also certainly sit down with you and have a chat. We just call it here our 15-minute consult, and so it's a free time for you to come in, sit down, and ask me questions. See if you like me, see if you like my personality, if you like my office, you like my staff. It gives me a chance to get to know you, but it's more a chance for you to say, okay, do I get a sense that this guy knows what he's talking about, and that I feel comfortable putting my health into their hands? Because again, at the end of the day, it's their health, and there's nothing much more important than your health. So you want to make sure that you trust the person, that you feel they're coming at it from a point of integrity and authenticity, and that they're going to look after you. They're going to tell you what you need to hear, and that you feel comfortable agreeing with that.
Again, those are some really terrific insights, Dr. Dower. I'd like to thank you very much for being on the show, your time and sharing your expertise and insight based on your many years of education and training. If listeners want to get in touch with you directly, how can they do that?
It's pretty easy. We have a website, so it's just, I'll spell it out first. It's DRDOWER at, drdower.ca. So DRDOWER.ca. Or our phone number here in Toronto is 416-920-7275. But the easiest way probably for patients to learn more about chiropractic and about our practice would be to go to drdower.ca.
And again, that's DRDOWER.ca.
Perfect.
Fantastic. Once again, thank you very much for your time and expertise on the show today.
Thanks again for the great questions, Paul. I really appreciate the opportunity.
Thank you. Bye-bye.
Bye.